Hi there, my name is Cosette Faivre. I am a veterinarian at the Hagyard Equine Medical Institute, and I'm here to talk to you guys today about equine metabolic syndrome, which is a metabolic disease that we can see in older horses, but really doesn't have an age predisposition to it. Equine metabolic syndrome is actually a constellation of clinical signs or risk factors that put horses more at risk for developing hyperinsulinemic laminitis. When I talk about risk factors, they fall into two different categories: genetic risk factors and environmental ones. So genetic risk factors would be things like breed, family predisposition of laminitis, and predisposition to obesity. And environmental risk factors would be high carbohydrate diets specifically, so high levels of grains, high carb pelleted rations, or especially here in central Kentucky, access to fresh spring pastures. A horse with a high genetic risk that is in an excellent management program may have no clinical evidence of disease, and a horse that has a low genetic risk but is in a risky environment may have more evidence of clinical disease. Some overrepresented breeds that we can see with equine metabolic syndrome include our miniatures and our ponies, our Arabians, Spanish breeds, gaited horses, Morgans, and warm bloods. Clinical signs of equine metabolic syndrome, again, are laminitis. So sometimes this is not overt laminitis. Sometimes this is evidence of it on the hooves with their divergent growth rings. We can also see radiographic evidence, sometimes even before these horses get clinically lame. We also typically see these horses have an obese body condition, so they tend to be a little bit overweight, but they don't have to be. And we can see abnormal fatty deposition, a crusty neck, a lot of fat around the shoulders or the tail head as well. So what is laminitis and why is it bad? Laminitis is basically stretching and inflammation of the laminae, which are the fibers that hold the coffin bone, or P3, within the hoof capsule itself. And when a horse gets laminitis, it can cause rotation or sinking of that coffin bone within the hoof capsule. This is an acutely and severely painful disease of horses, and it can be debilitating. It can necessitate complete retirement from athletic activity or euthanasia on humane grounds if we can't manage this horse's discomfort. So it is something we actively want to prevent in our horses. Again, most horses with equine metabolic syndrome have an insidious onset of disease, so they may have multiple subclinical episodes of laminitis where they're developing radiographic changes or changes on x-ray, but we are not seeing that horse necessarily be lame clinically. Oftentimes there's one episode that sort of tips them over the edge where they finally become clinically lame. We can do a couple different tests for equine metabolic syndrome that involve assessing their insulin and their insulin response to a meal. So do make sure you're checking with your vet about the tests that are best for your horse. Most of these tests do require a complete or partial fast before the test, so make sure you're just checking in within 24 hours to ensure you're meeting the testing protocols. Equine metabolic syndrome can also frequently co-occur with PPID or equine Cushing's disease. We know about 30% of horses will have both. So if you have a horse that has tested positive for one, it's oftentimes beneficial to test for the other as well. These horses do sometimes have an increased sensitivity to glucocorticoid treatment, so steroid treatment. So do make sure you are checking in with your veterinarian before starting a steroid treatment to ensure that their risk of having a laminitic flare is going to be low. Treatment for equine metabolic syndrome is multifaceted because this is ultimately a disease of management. So when I say management, I am talking about diet, exercise, and housing, and that accounts for 80 to 90% of the things that we can do to help treat this disease. With diet, we really want them on a low carbohydrate diet. So this is no or very limited pellets, no grains, limited or no pasture and no treats. So this is very much the biggest loser, tough love kind of diet, especially in the initial stages, because we are really trying to aggressively and quickly manage their insulin levels and their weight in order to reduce their risk and improve their comfort. And as they respond to those diet and management changes, we can dial back on the intensity of that diet and start adding things back in. When it comes to housing, these are oftentimes animals, if they're in an acute laminitic flare, they typically need to be housed in a stall on some very soft and deep bedding to improve their comfort. And we can eventually move them out onto sort of a dry lot type area so they can get out and move around and still have the benefits of exercise without having access to a lot of the fresh grass that we, especially here in Kentucky, have. And then when it comes to exercise, we typically want all horses, all of these metabolic syndrome horses, to be exercising. Obviously, if they're having an acute laminitic flare, we don't want them exercising until that is completely resolved. And once that has, we want them to be moving up through some exercise regimens, starting off, with some trot work and moving into canter work. At the end of the day, in an ideal world, these horses are doing some fast trot to extended canter work for at least 30 minutes, 3 to 5 times a week. But obviously that's a pretty big time commitment for a lot of people. So any exercise is beneficial, but that's sort of our most established and most beneficial protocol. When we talk about the sort of baseline diet for an EMS horse, we really want that to be hay focused. So we have formulations and calculations that we can do to figure out how much hay a horse should be eating for their body weight, their exercise level, and their life stage. And so we can calculate the amount of hay that a horse should get to maintain all of those things. And so that's usually where we start when we want to come up with a diet for these horses. We may also start soaking the hay, so a 60-minute soak in cold water to help reduce some of those sugars. And in some horses that are very refractory with their insulin levels, even to this protocol, we can do things like test the hay. So all hay has different carbohydrate levels, and we can test that. We can test the non-structural carbohydrate, or the NSC, of the hay to try and figure out if we have a low carbohydrate hay for this horse. And then in some cases, we may also go to a complete pelleted ration that is a low carb specific ration or a low carb specific diet, so that we can more precisely assess that horse's carbohydrate intake. Some horses do have EMS, but they are in fact not obese. We can see horses that have a normal body type or that are even thin. Those cases can be a little bit tricky to manage because we do need to still keep that same low carb diet while not restricting their calories as much as the typical EMS horse. That oftentimes involves adding a certain amount of fat into their diet with fat supplements or oils in order to make up those additional calories. Additionally, most horses we want to have on some sort of ration balancer or vitamin and mineral supplement to ensure that they are still getting all of their appropriate micronutrients while they're on this more restricted diet. Another very important aspect of caring for your EMS horse is hoof care. So no matter what stage of disease they're in, whether they're pre-laminitic episode and we're just doing some maintenance on their feet to maintain appropriate hoof angles relative to their x-rays, or if they're in an acute laminitic crisis and need some more aggressive hoof intervention, it is very important to have a great farrier on your horse's team that can help you navigate, the different changes in your horse's hoof that are happening while he has active laminitis. The last thing that we can do to help these horses with laminitis and equine metabolic syndrome are medications. Medications are not a replacement for these management changes and should typically only be instituted if a horse has failed to improve or improve enough on diet and other management changes. The first drug that we think about is levothyroxine. So this is a supplemental thyroid hormone that basically increases the horse's metabolism and allows them to burn weight more easily. Again, this is a drug that is usually reserved for horses that are either in an active laminitis flare and can't exercise, or horses that have not responded appropriately to their initial round of management changes. Levothyroxine should only be administered for about 3 to 6 months for some of that aggressive weight loss. When we make this a more chronic medication or go for longer periods of time, we can run into some long-term side effects and, most importantly, some cardiac problems and cardiac abnormalities. So we really don't want this to be a long-term medication for horses. The other medication we think about with metabolic syndrome is a drug called metformin. This works by limiting the amount of sugar that's absorbed in the intestine. Unfortunately, this drug only works in a pretty small percentage of horses, so it's not uncommon for it to not be a successful part of a treatment plan for a horse, but it is definitely worth trying to see if it is beneficial for your horse. The last class of drugs that we can think about for our EMS cases is a class called sodium glucose cotransport 2 inhibitors, or SGLT2 inhibitors. And these drugs are pretty new to the equine metabolic syndrome scene. They work by increasing the amount of sugar that's lost in the urine. And they are very effective drugs. However, because they're so new, they're pretty expensive, so we're usually reserving them for animals that have failed 1 or 2 rounds of treatment interventions. We also do want to make sure that we're monitoring liver and kidney values and triglyceride levels while we have horses on these drugs, because they can cause changes in those that we may need to modify our dose on. Ultimately, again, equine metabolic syndrome is a disease of management, and so we really need to be managing these horses initially pretty aggressively, but we can see significant improvements, again, in their comfort, in their hoof care, and in their quality of life once we make these management changes for them. Ultimately, our senior horses are a really enriching part of our lives, and like senior humans, they may require a little bit more frequent medical care and medical reevaluation. So they may require just more frequent assessment as far as dental exams or blood work to make sure that we're finding some of these problems earlier in the course of disease, so that we can intervene sooner and prevent some of these, adverse effects down the line, like laminitis or complications from PPID. Ultimately, our goal is to make their senior lives as comfortable and as long as they can be, so that we can continue to enjoy them and they can continue to enjoy us.